Transitioning into adulthood can be a difficult time for teens, but even more so if they don't have the guidance of parents. Now, the Nebraska Department of Health and Human Services is launching a new program to help former foster children, known as wards of the state, make that transition easier. It's a bridge to independence.
Being a foster kid, it's complicated.
Stormy Chesmore grew up in Valley, Nebraska, and things weren't picture perfect. They were quite foggy, in fact.
When I was like about 15 years old, we had some family complications.
That's when she was placed into foster care, becoming a ward of the state of Nebraska.
I went through multiple homes.
And what should have been a milestone birthday was a tough one for Stormy, turning 18.
You don't technically have parents. You're on your own. You don't have anyone to lean on.
That's where the Department of Health and Human Services wants to change.
If you look at the data in the research, a lot of the children and youth that age out of foster care really struggle to be successful.
The solution? The Bridge to Independence program.
We want to be able to make sure that these kids aren't fall through the cracks and they don't end up going to jail.
Thomas Pristo is the Director of Child and Family Services.
This helps them with housing, transportation, education. They also get medical coverage with this program, and they get a stipend up to $760 a month.
So this is kind of a stepping stone for those young adults as they transition into this next period.
It is a stepping stone for them, and it is a way to ensure that they get the skills necessary to be successful as young adults.
But it's more than that.
This is my cat, Franco.
It's attention.
He, basically my emotional support cat.
They need support from families that may not be there, and that's what this program allows.
Each teen is assigned an independence coordinator who they meet with once a month.
It's basically like a best friend, and the people that they assign you, it's crazy how the personalities match yours.
Helping Stormy learn tasks many of us take for granted.
How to open a checking account, grocery shopping, how to do a budget.
Take, for example, when Stormy tore her ACL a few years ago. She didn't know what to do.
I didn't know how to get insurance.
But now she's taken care of with the help of her newfound family.
Without Medicaid, I would not be able to afford a nice brace to help me.
She's traveling down her own bridge to independence.
They won't ever replace a parent, but they're up there. They're like right next to a parent.
The program started ahead of schedule, kicking off October 1st. Legislation passed this last session, but federal approval was needed. About 180 young adults, 19 to 21 years old, who were in abuse and neglect cases are eligible for this program this year. There are qualifications, which will be posted on our website at nbcneb.com. The requirements aren't as strict as the previous former wards program, which Stormy says makes a big difference for teens. DHHS hired 20 counselors and 2 supervisors for the program. And I asked Thomas if he thinks Bridge to Independence will shine a better light on DHHS after several scathing audits over the past few years. He said he hopes so. As for Stormy, she's a junior at UNK. She's majoring in athletic training and business management. Wants to work with athletes in the future. Just spoke to her tonight. Just a wonderful girl, and want to thank her for sharing her story. Absolutely amazing. Hope that program helps other people in the state too.